up for questions.
Thanks, Jeff. And as a reminder, please keep your question to one question. There are many today. First, let's go to Lev Thatcher at Stat News.
Hi, folks. Thanks, as always, for doing the briefing. This is a Mike Ryan quote from a WHO briefing earlier today about booster shots. If we think about this in terms of an analogy, we're planning to hand out extra life jackets to people who already have life jackets. And I'm curious, I know you've emphasized, all of you, that this is a false choice, vaccinating Americans versus vaccinating the rest of the world, but could you explain how there isn't finite vaccine capacity and how booster shots for Americans does not at this moment come at the expense of first vaccine or second vaccine doses for folks elsewhere in the world?
So let me go first, and then Dr. Murthy, if you want to add anything. Look, to end this pandemic, we have to protect the American people, and we have to continue to do more and more to vaccinate the world. Both are critical, and we're already proving that we can protect our own people here at home as we help others. Just to give you some data here, in the months of June and July, the U.S. administered 50 million shots here in the United States, and we shipped more than 100 million to other countries. As I said, the 115 million doses that we've already donated is more than all the other countries combined. And during the coming months, when we talk about booster shots, we expect to give about 100 million boosters in the United States. And at the same time, we will be donating more than 200 million, twice that number, additional doses to other countries, on our way to donating more than 600 million vaccines. So we are continuing to serve, as the President has said, as an arsenal for vaccines for the world. And you'll see us do more and more. This builds on our support of the TRIPS waiver, our commitment to COVAX, where we are the largest contributor, the Quad partnership, which we helped to establish, which is on track to produce at least 1 billion doses of COVID vaccine in India for the Asia region by the end of 2022, and our work to support vaccine manufacturing in Africa by providing financing to a South African business to bolster manufacturing capacity to produce more than 500 million doses. And we're just going to keep going and going and going. So this is a situation where we're going to do both. We're going to both protect the American people, and we're going to do more and more to help vaccinate the world. Dr. Murthy?
Well, thanks, Jeff. And Lev, good to hear your question. Appreciate it. Look, I do not accept the idea that we have to choose between America and the world. We clearly see our responsibility to both, and that we've got to do everything we can to protect people here at home while recognizing that tamping down the pandemic across the world and getting people vaccinated is going to be key to preventing the rise of future variants. We know that, we see that clearly, and we believe we have to work on both fronts as we have been. But Lev, when we see data that is giving us essentially indications that protection is starting to diminish in terms of mild, moderate disease, when we recognize that if this trajectory continues, that people who are well protected today may see more vulnerability in the future, we have to act. The science tells us that, our clinical judgment tells us that, and that was a collective decision of the top public health and medical experts in this administration. So again, we will do everything possible to protect people in our country. That's why we're announcing this booster plan. But we will also continue to accelerate our efforts to vaccinate the rest of the world. We take that responsibility very seriously.